Dr. Cynthia Warner and Shannon O'Kelley, part 3 of their conversation on KOMO. Dr. Warner, thank you again for joining us. Once again, we're doing a cardiac series. We've talked about signs and symptoms of a heart attack. We've also talked about AFib, and it's interesting when we talked about AFib on the last segment, you mentioned AFib can lead to strokes, and I wanted to talk about why, how, when, and basically what is a stroke. So tell us the concerns with strokes when it comes to cardiology.
Sure. So a stroke is basically when part of the brain is damaged because of lack of blood flow to that area. And the most common cause of stroke is usually because of a blockage in the blood vessel that serves that territory of the brain. That can be from underlying atherosclerosis, which can be a combination of cholesterol plaque and blood clot. It can be from blood clots that have formed from other diseases like atrial fibrillation, thought to cause and contribute to about 1 in 7 strokes. And there's increased risk of stroke with atrial fibrillation. But in general, those are the largest causes of stroke. There's about 800,000 strokes that occur in the U.S. each year. So stroke can be devastating, causing long-lasting disability and even death. So super important to get early treatment to help reduce the damage to the brain and hopefully minimize symptoms.
So in simple terms, I mean, what you're looking at here is some kind of a clot. It can either be a blood clot or it can be a piece of what you describe plaque. That little piece or clot floats through the bloodstream. It gets lodged usually in a smaller artery, and then it blocks blood flow to the tissue beyond that blockage, and that tissue without blood is going to die or become necrotic, and that's the worry.
Correct. That is the underlying process that we're talking about. If it's in a heart artery that feeds the heart, that's a heart attack. If it's in a blood vessel that feeds the brain, that's a stroke.
What are early signs and symptoms? Because I know that if you detect this and get in early for treatment, they can bust those clots, they can stop bleeding. So there's a lot of medical procedures or opportunities if you get in early.
Exactly. So really being aware of early signs of stroke, very important. So we use the acronym of FAST or Be Fast to remember the signs to look for. So B is for balance. You look for, is someone having trouble walking? E is for eyes. Are you having vision problems? Fast now. F is for face. You look for asymmetry, or is there a facial droop on one side of the face? A is for arm. Is there weakness or numbness on one side of the body? S is for speech. Are you having trouble speaking? And then T finally is for time. Time is of the essence. If you're experiencing these symptoms, you want to call 911 quickly, like we said, to hopefully minimize the extent of brain that becomes compromised.
As we wrap up, as a cardiologist, any kind of suggestions for lifestyle changes that might help us reduce our risk of strokes?
Absolutely. So the things that you can do to decrease your risk of stroke: optimize your blood pressure, optimize your cholesterol, optimize your diabetes if you have that, all through diet, exercise, and medications if needed. And then if you have certain conditions that predispose you to forming blood clots, taking those medications to help prevent that. And then finally, don't smoke.
Yeah, and finally, I mean, most importantly, if you're having any kind of symptoms or any concern, get yourself checked. Go in and see your physician. Go in and see your cardiologist. It's so important to identify these risks and signs and symptoms early. The outcomes are much better if you can get to these issues early. Dr. Warner, again, thank you for your time. Next week, I'm excited. We're going to be doing, I think we're talking hypertension, which is a big topic, but we're going to talk about that next week. Thank you again.